Okay, so what were the birth defects that I had? I had something called a Chiari malformation, in which part of your brain, the cerebellum, they call them the cerebellar tonsils. So those are what sits in the back of your skull, below your occipital lobe, and they sit kind of right in that groove. Some of those were making their way into my actual spinal column area, and so my brain was taking up room that my spinal cord should have had space for. So that can put pressure and compression on those areas. Okay, so how did I find this? I was having uneven pupils, and my eye doctor at the time, I was having weird symptoms. Like I was teaching anatomy on the board. I was numbering 1, 2, 3, 4, 5, 6, 4, 5, 6, 7. Like I couldn't number 1 through 15 doing the cycles of the blood flow through the heart. Like I could not do it. And I did it in multiple classes, and I couldn't number 1 through 15 correctly on a board with them right in front of me. And I went, whoa, something is going on. So I thought I had a brain tumor is what happened. So I had my MRI. The doctor that I was seeing at the time thought that I just had subclinical hypothyroidism, which I actually didn't know that at the time, did have that. But that's what he was, blaming the symptoms on. And so what I looked at, because I had already seen the report, and then I ordered a copy of the MRI, and I was like, no, that's a Chiari malformation. I know that. I learned this in school. When I saw it in school, I thought, oh, I have that. Sounds like me. I'm like, Mayo Clinic wouldn't have missed that. I didn't know I had a copy of that MRI from back in high school when I had just, turned 18. I didn't realize it. I found it in my closet because my mom had passed away, and we had, I'd gotten all of the films that had been mine, and they were just stuck up in an extra bedroom. I didn't really think to look at it. So I looked at it and I went, oh, it's been there. Was on that MRI. Mayo didn't see it. This doctor didn't see it. I got a different doctor. Got a referral to the neurologist. The neurologist told me that it was just an incidental finding. Then proceeded to order tests that she never really ordered. So I was really not happy that I didn't actually get followed up with on the stuff she actually wanted to order. So anyhow, I get frustrated with that. I find the Wisconsin Chiari Center of Wisconsin with Dr. Havez. I send all of my films into him. He says, yes, I need to see you. This could be Chiari. Let's take a look. Had different MRIs with him. Yes, in fact, I had a Chiari malformation. Had the surgery because now at this point, I couldn't put my head down without having zinging pain down my spine. I have sensitivity to too loud of noises. My stomach was upset a lot of the time. I still had a lot of numbness, burning, and tingling in my arms. Was not able to lift. Had to stop exercising a lot. Was tired. All these symptoms that were present from when I was 13 years old. They actually had a reason and they had a solution, right? So I had surgery in which they took part of that occiput or occipital bone. They shaved some of it off, put mesh in there. They're trying to give more room for those cerebellar tonsils to sit so that they don't make their way into the spinal canal. So I think it's over. I'm like, okay, great. Well, then I go back to even worse. I still can't talk. I'm still having these weird dizzy spells where I'm throwing up and I'm still not well. And I'm going, what in the heck is going on? So then I realized I had a tethered cord. So what is a tethered cord? The spinal cord gets held down too tightly. It's supposed to end at level L1, L2. Mine ended at L2, 3. I have 6 lumbar vertebrae. I had to send those films in to Dr. Havez again. Usually you do the tethered cord release first, then the Chiari. I didn't realize I was having so many leg symptoms until after I had the first surgery. So then I had the tethered cord release. So they cut where the spinal cord is held down so that it could come back up and not, be under constant tension. So I was like, okay, finally, good. Oh, some relief. I thought that would be, the end of health challenges. Well, thyroid issues, digestive issues, they were still yet to come. But I felt so much better. And all of this was something that literally 14 years earlier, I had in my possession the answer, and nobody saw it. And everybody just overlooked it. And, oh, it's incidental. Oh, this couldn't possibly cause a problem. Well, if your brain is coming out of your skull and going into your spinal cord area in the spinal canal, it can be a problem. So anyhow, just things that I happened to find, needed the surgeries, debated. I mean, who wants brain surgery? I didn't want brain surgery. You're in ICU for 2-3 days. You're in the hospital for 5. You have to lay completely flat because you have to let the dura mater heal, or the protective covering connective tissue over the brain. It looks kind of like I think of it like a swim cap, like over the actual brain. Very strong connective tissue material. Anyway, so I did all of that. I was still practicing. I had to kind of pause practice for a little while. I was still teaching in 2 different places, at the local tech college as well as at a massage school. So I was doing all of these different things still post-surgery. Wound up with this big labial abscess that I had to cut open, get drained. Then it filled right back up. It didn't stay closed. I'm getting on an antibiotic, which I don't want to be on, but I'm going, I can't have just had brain surgery, not be able to sit down because I have this huge abscess from the catheter. And I'm like, what are my options right now? Because I have kids to feed. I have, jobs to do. I can't just not do this. So anyway, then you're faced with more of these decisions. Like, this really goes against everything that I would like, but I also don't want to cause a bigger problem at this point because I've just had my head opened up, right? And so, all of these different, challenges that we face. And I just kind of, you look back on it and you're like, wow, that was a lot, but I got through it, right? I get through every single one of those tough days. But I've been there. I know what it's like. I've had the surgeries. I've had the pain. I've had the problems. So I do know, in fact, what it is like. So again, I'm Dr. Erin Daniil with the Rejuvenate Life app, rejuvenate-life.com. It's important what you do with your dash.